Good day, everyone. Today, we will be discussing about histopathology. So, what is histopathology? Histopathology is the diagnosis and study of diseases of the tissue and involves examining tissue or cells under a microscope. Histopathologists are responsible for making tissue diagnosis and helping clinicians manage a patient's care. So, histopathology, it refers to the microscopic examination of tissue in order to study the manifestation of disease. Specifically, in clinical medicine, histopathology refers to the examine of a biopsy or surgical specimen by a pathologist. After the specimen has been processed and histological sections have been placed onto the glass slides. Why histopathology is important? Histopathology enables professionals to look for changes in cells that explain the actual cause of the patient's illness. And pathologists are able to reach a diagnosis by examining a small piece of tissue from various organs. Histopathology is vital as it broadens and progresses treatment options. Histopathology on cancer diagnosis. Histopathologists provide a diagnostic service for cancer. They handle the cells and tissues removed from suspicious lumps and bumps, identify the nature of the abnormality, and, if malignant, provide information to the clinician about the type of cancer, its grade, and, for some cancer, its responsiveness to certain treatments. So, the histological slides are examined under a microscope by a pathologist, a medically qualified specialist who has completed a recognized training program. This medical diagnosis is formulated as a pathology report describing the histological findings and opinion of the pathologist. In the case of cancer, this represents the tissue diagnosis required for most treatment protocols. In the removal of cancer, the pathologist will indicate whether the surgical margin is cleared or is involved residual cancer or is left behind. This is done using either the bread loafing or CCPDMA method of processing. Microscopic visual artifacts can potentially cause misdiagnosis of samples. The role of histopathologists. Many histopathologists specialize in specific organs, such as liver or skin, dissecting tissues for viewing under microscope on a daily basis. For large specimens, such as samples of bowel or breast following surgery, these are dissecting to select the most appropriate areas to examine under a microscope. Histopathologists write reports on specimen, consult with literature, and many also have teaching and research responsibilities. Histopathologists also examine cells in smears, aspirates, or bodily fluids, for example, in urine or cervical smears. Other subspecialties include forensic pathology, neuropathology, and pediatric pathology. This can be done to slides processed by a chemical fixation or frozen section slides to see the tissue under a microscope. The sections are stained with one or more pigments. The aim of staining is to reveal cellular components. Counterstains are used to provide contrast. The most commonly used stain in histology is a combination of hematoxylin and eosin. Hematoxylin is used to stain nuclei blue, while eosin stains cytoplasm and the extracellular connective tissue matrix pink. There are hundreds of various other techniques which have been used to selectively stain cells. So, histopathologists also work directly with patients. For example, they may carry out procedures such as fine needle aspiration in head and neck or breast clinics. They increasingly have key responsibilities for cancer screening at the moment for breast, bowel, and cervical cancer, with other programs expected in the near future. So that's it. Thank you for listening.